Syrebo Smart Rehabilitation Mirror integrates mirror visual feedback and motor imagery principle. The kit includes a desktop adjustable mirror and a speech therapy mirror to greatly improve the comfort of use. The angle of the mirror can be adjusted from 70 degrees to 90 degrees. Patients can move the mirror to a comfortable position to relieve neck pressure. The mirror will create a reflective illusion of an affected limb to trick the brain into thinking movement has occurred without pain, or to create positive visual feedback of a limb movement. For patients with hand dysfunction and no speech impairment, basic mirror training is recommended. The unaffected hand is trained and the patient observes the image in the mirror and imagines the movement of the affected hand. Patients can choose to perform basic movement training, palm extension and grip training, finger training, wrist flexion and extension training, functional movement training, and so on. Using combined with Syrebo rehabilitation robots for better training performance. For patients with only speech dysfunction, it is recommended to use speech training. Patients can practice speaking by looking in the mirror and slowly moving the mouth.